This episode of The Benefit Whisper is brought to you by Route 3 Insurance and Financial Services, where smarter benefits begin. If you're tired of rising healthcare costs and opaque insurance contracts, Route 3 is here to help you take control. They specialize in transparent, employer-driven benefit strategies that protect your people and your bottom line. Ready to break away from the status quo? Visit www.fixmybenefitsnow.com and discover how Route 3 can help you build a plan that actually works for your team and for your budget. What if the most valuable plan assets in your health plan aren't your premiums, your reserves, or your stop loss, but the data that you have never actually seen? Today's guest argues that pricing information and health claims data should be treated as an ERISA plan asset. If he's right, that doesn't just tweak the rules, it rewrites who owns what. And if you're a plan sponsor or an HR leader, this could change how you look at every contract that you've signed in the last decade. So we all are talking about fiduciary duties. However, sometimes we aren't able to do them because of things like this. I'm Ralph, and welcome back to the Benefit Whisper. I am your host, and on this show, we're going to talk a lot about cutting waste, fixing misaligned incentives, and giving employers back control of their health plans. But if you can't control what you can't see, then most of the plan sponsors are being asked to act like fiduciaries, but they don't have the data. So while flying blind, it's almost undoable. So my guest today is someone who has spent years in the engine room of health policy, Chris Condeluci. He's an attorney, a lead attorney of SIA, the Self-Insurance Institute of America, and former tax benefits counsel to the U.S. Senate Finance Committee. He has been deeply involved in the Affordable Care Act and the Transparency Act, CAA, Coverage Rules, No Surprises Act. And after the emerging world of compensations disclosure, he has been very, very busy. Chris has been making a powerful argument. Pricing information and healthcare data should be treated as ERISA plan assets. And if regulators and courts keep moving in the direction, it could fundamentally change the obligations of carriers, TPAs, and PBMs, and dramatically expand the rights of employers. So, Chris, thanks for joining me today on the Benefit Whisper.
Thanks for having me.
Yeah. Do you want to tell us just a little bit about yourself that I may have missed?
No, I think you covered it. Again,
Okay.
Chris Condeluci. I'm a benefits attorney. I've been practicing for 20 plus years now. It's crazy to say that. I worked for the U.S. Senate Finance Committee, as Ralph indicated, and had the opportunity to participate in the development of the Affordable Care Act. I've leveraged that experience, my ERISA, ACA experience, tax-free health experience into what I do now.
Excellent. That's great. And you certainly are very important in today's environment, if not always, because it's changing so quickly. So let's start with compensation disclosure, transparency 2.0, and data sharing. I want to kind of connect this to a couple of other big shifts that you've been talking about, compensation, transparency, stronger data sharing environment, et cetera. So why don't we start with compensation disclosure?
Yeah. And to go back to your point, I've been working extensively in the transparency space, CAA, even the transparency regs that came out in the first Trump administration, as well as just everything ERISA, fiduciary, which are all the topics that we're going to hit today. So to your question, all of us have been anxiously awaiting some proposed regulations that would improve and strengthen the transparency and coverage rule, the TIC rule, the rule that requires healthcare payers to publicly disclose in-network and out-of-network rates. Just taking a step back, last year when the presidential election came and went, and we had the results and the dust settled, many of us proponents of transparency and increasing the public disclosure of in-network rates, for example, we're excited. We figured, the Trump administration was the first administration that issued regulations requiring the public disclosure, that this next administration would undertake what I'm calling, or what many of us are calling, a Transparency 2.0 exercise. And while that Transparency 2.0 exercise has gone a little bit slower than we had thought, the government shutdown had an impact on that as well. The Department of Labor back in September told us that there will be regs coming out sometime in October that would improve and strengthen the transparency and coverage rule. Again, the government shutdown happened at the end of September, really the beginning of October. It just ended 2 days ago. I am expecting that we will see proposed regs on the tick rule between now and the end of the year. And then the question is what might we see in that reg? And
Right.
I've been speaking to that issue of, well, one thing that many industry stakeholders can agree, there has been a lack of compliance on both the hospital transparency side as well as the tick payer side. And what I mean on the tick side is there's a strong argument that insurance carriers who are populating the machine readable files for both fully insured arrangements as well as self-insured plans, because many self-insured plans rent their networks from the insurance carrier who is providing that provider network. Carriers are inputting inaccurate, incomplete, incorrect information, and sometimes the information is omitted. So
Really?
one of the biggest pushes among industry stakeholders is, hey, let's increase penalties for non-compliance for both the hospital rule as well as the tick rule. And we could very well see increased penalties included in these proposed regulations. Related to increased penalties, we're also expecting to see in these proposed regs a requirement for routine audits. Audits typically produce compliance and is an enforcement mechanism. So if we see more audits and routine audits among either a statistic sample of payers or specifically picked payers, depending on the geographic region, those routine audits should also help with the compliance issue that I just articulated. Another issue that we'll likely see in the proposed reg is an attestation requirement, not on the plan sponsor, which is an attestation requirement we see in the gag clause prohibition, which we can explain a little bit later, but I think most in your audience know the gag clause prohibition attestation requirement. But here would be an attestation requirement on the insurance carrier, the carrier being responsible for inputting that information into the machine readable file. And that attestation requirement would effectively require the CEO or an authorized representative of that carrier to attest to the accuracy of the pricing information that's set forth in the machine readable file. We're also expecting that there'll be some uniformity between the negotiated rates that are set forth on the hospital machine readable file with the negotiated rates that are set forth on the tick file. So there is some uniformity there. Many folks have been arguing that the machine readable files are just unbelievably large. But we did see a schema 2.0 that was released back in October 1st, which should have an impact on decreasing the size of machine readable files. So that's at least a little bit of what we're expecting in the proposed tick regulations and regulations that I'm hopeful that we will see at the end of this year.
Wow. So not too far away. So what's next for PBMs and TPAs? And more importantly, you've mentioned the enforcement of data sharing. So let's connect this to the idea of the data being a plan asset.
Before I get to that, let me mention this, if you'll indulge me.
Sure.
Another set of regulations that we are expecting, and you mentioned about TPAs and PBMs, is on the compensation disclosure. As many may know, the CAA enacted what's called ERISA Section B2B, compensation disclosure related to health plans. And that compensation disclosure requirement requires certain plan service providers that perform certain services to disclose direct and indirect compensation to the plan fiduciary. Now, interestingly, the statute refers to brokers and consultants, but it enumerates a number of services that would otherwise trigger the compensation disclosure requirement. Well, TPAs and PBMs in particular have taken the position that they're not subject to the compensation disclosure requirement because they're not brokers or consultants. But Congress always intended to pull in PBMs that performed certain services as well as TPAs that perform certain services. So a lot of people may not know, back at the end of 2022, Congress sent a letter to the Department of Labor indicating what Congress intended, which was if PBMs and TPAs are engaging in certain activities or providing certain services like negotiating rates, putting provider networks together on the prescription drug side as well as the medical provider side, as well as adjudicating claims on the prescription drugs as well as the medical side, that triggers the compensation disclosure requirement. However, the Department of Labor has never issued any regulations. That congressional letter has led to the Trump administration issuing an executive order back in April in which the Trump administration directed the Department of Labor to issue proposed regulations clarifying that PBMs are subject to the compensation disclosure requirement.
Okay.
And the Department of Labor has told us that we should see those regs. Well, they told us before that we'd see those regs in November. That was
Right.
prior to the government shutdown. I'm still expecting that we'll see those regs by the end of the year. If we don't, we should see them in a January to February timeframe, once again clarifying that PBMs are subject to the compensation disclosure.
Right. That makes sense. Meaning what they compensate occasionally to brokers? Is
I
that
would say
included?
to the plan. So to take
Mhm.
a step back,
Right.
the disclosure would be plan sponsor hires PBM. How much is the plan paying the PBM?
Okay.
So that's direct compensation.
Right.
But there's something called indirect compensation, which are finder fees,
Mm.
discounts, kickbacks, if I could go so far as to use that term.
Sure.
And that indirect compensation similarly must be disclosed to the plan fiduciary. Now,
Right.
actually, I mean, since you asked the question, we are expecting that these proposed regulations to actually be pretty detailed when it comes to the disclosure of the PBM's payment practices to the plan fiduciary, which is almost not too dissimilar from some legislation has been introduced that maybe we see, maybe we don't see, but along the lines of PBM practices, like what are the gross payments for the prescription drug that the plan pays for the year? What's
Mhm.
the net amount that the plan is paying for the year? What are the amount of rebates
Mhm.
that the PBM is receiving? Is the PBM passing on all or a portion or none of those rebates onto the plan and the plan sponsor? And we could very well see that type of required disclosure of the
Mhm.
PBMs in this forthcoming proposed regulation on compensation disclosure.
Wow. Interesting. So, Chris, you and I have spoken. So, a lot of employers, and for those employers that are listening who feel that they're being stonewalled on data, what rights do they have today, and how can they enforce them? How can they demand their own data?
Yeah, it's an excellent question and been one that's been vexing a lot of folks. And it's almost like getting blood from a stone or banging your head up against a cement wall
Hmm.
because there are limited things that employer plan sponsors can do to get that data. Or maybe not limited. There are things you can do, but if the other side of the table, that carrier TPA who possesses that pricing information or possesses that claims data and or the PBM that you're trying to get certain information from. If they're on the other side of the table and they're like, we're not going to share this information with you,
Uh-huh.
irrespective of what legal arguments you might raise, that we
Right.
own the data. The gag clause prohibition requires disclosure of that data. It is advisable for plan sponsors to go back into their administrative services agreements
Hmm.
and renegotiate those contractual terms. But that also is not an easy thing to do. You could go back and you could hire a lawyer like me. I could go back into that ASA and I could say, okay, here are the offending contractual provisions, and I would redline them and I would rewrite. We'd
Hmm.
send them to the TPA and or the PBM, and we get back, a rejection of those red lines. And
Right.
so there are some things that you can try to do. You can, again, point to the legal arguments of ownership, gag clause prohibition that Congress said you must share the data, but
Hmm.
oftentimes that falls short, or again, you're banging your head up against the wall because the other side of the table is saying, no, we're not going to share it. We don't think you own it. We own it. We do not think the gag clause prohibition applies to us. And if we're going to negotiate a contract, you're going to have to abide by our terms. So it's almost a
Wow.
contract adhesion scenario, which is
Hmm.
unfortunate. So those are some things that employers can try to do. But maybe your question really segues into what you led with, which
Hmm.
is, can the government, really the Department of Labor or Congress, clarify that pricing information and claims data, which is information that the plans want, and then I'm explaining to you that plans are trying to get, plan sponsors are trying to get, but the other side of the table is not giving that information. Can there be a clarification that that pricing information and claims data is considered an asset of an ERISA covered plan or a plan
Hmm.
asset? And why am I or some others suggesting that? Well, I try to break it down this way. Plan sponsors are under an ERISA fiduciary duty
Right.
to keep health plan costs low and act in the best interest of participants. That's
Sure.
ERISA's fiduciary duties. I actually believe, and I'm of the opinion that now that the data is out there or
Mhm.
at least can be accessible. Now I know we're going to
Right.
talk about the problem, which we're not getting that data, but
Hmm.
trying to access that data and then once you get it analyzed and evaluated, I believe plan sponsors are under a fiduciary obligation to try to access that information, and when they do, analyze it and evaluate it. That's what
Right.
a prudent fiduciary would do. Now, the problem is if I'm suggesting, which I feel confident in my suggestion, that plan sponsors are under that fiduciary obligation to
Mhm.
analyze and evaluate that information. If they can't get that information, if they can't get the data, then they
Right.
can't meet their fiduciary obligations.
Makes sense.
Now, Congress tried to fix that, right? We have the
Mhm.
gag clause prohibition, which was intended
Right.
to really allow the plan and the plan sponsor to get the data from the owner of the provider network, an insurance
Mhm.
carrier or a TPA, for example, that's running the network
Right.
to that self-insured plan, using that as an
Mhm.
example. That hasn't been the case. Those owners of the provider network, those insurance carrier and TPAs continue to refuse to share the data. The pricing information, we talked about, the tick regulation, that
Mhm.
requires public disclosure of in-network rates. Well, if the carrier TPA that's inputting information into that machine readable file is providing inaccurate, incorrect, and sometimes omitting information, well, then you don't have accurate and complete information. So once again,
Mhm.
the plan sponsor is like, I have this fiduciary obligation, but I can't do my job. So if Congress and the gag clause prohibition and the regs on the tick side aren't doing what the government wanted them to do, or what we as the industry are hoping would be done, how do you compel the insurance carrier and TPAs, for example, to share the information, both on the pricing as well as the health claims data side? Well, an argument is clarify that that information is a plan asset,
Mhm.
clarify that that insurance carrier and TPA, for example, has discretionary authority over that plan asset
Mhm.
because they possess it. They
Right.
can decide how to use it. They can decide how to dispense of this plan asset, which under ERISA says if an entity can use or dispense of an ERISA plan asset,
Mhm.
that makes you a fiduciary.
Sure. Absolutely.
So backing up, clarifying the pricing information, claims data
Mhm.
are a plan asset, clarifying that the service provider that possesses the data can use or dispense of it, that proves that service provider has discretionary authority
Mhm.
over the plan asset, which therefore makes them a fiduciary. Now, the last point I'll make is if they're a fiduciary, they are similarly subject to the duty to keep health plan costs low, to act
Right.
in the best interest of plan participants.
Mhm.
And if that service provider is not sharing the data, that's not in the participant's best interest.
Right.
That certainly is contrary to keeping health plan costs low. Same with populating or coming up with accurate and complete pricing information. If that information is not accurate or complete, that is contrary to the fiduciary obligation that you now,
Mhm.
as this ERISA fiduciary, is under.
Right.
Query though, can we get from here to there? Can the Department of Labor, can Congress clarify that this information is indeed a plan asset?
Right. Wow. So it's very important. Now, when you talk about pricing, is that the negotiated allowable charges or is it what's actually being paid? Because we both heard of a lot of examples where the TPA is paying more than the charge rate, for example, which of course is way higher than the allowable.
Yeah, I would pause to say, generally speaking, my argument is the pricing information that is, for example, disclosed in the machine readable files.
Hmm.
Now, an argument can be made that that information, while let's say purportedly accurate, is not necessarily accurate based on what you articulated. That in some cases, there might be an additional reduction of the reimbursement rate for a particular negotiated rate. And the percentage of, let's say, Medicare for that particular medical item or service could vary for one reason or another. How do you get to almost that net cost? I think
Right.
that's an open question that we can even debate, on our next podcast if
Yeah,
you have me back.
absolutely.
But
Yeah.
but I think I'm just more on the surface suggesting that, look, you need the pricing information to understand your own rates that you're paying, understand what other networks are charging and what your competition might be. And if plan sponsors have that information, they can shop around to different networks,
Mhm.
they can develop their own networks. There are many opportunities to really make actionable that information to keep health plan costs low or to lower
Mhm.
healthcare costs, which is in the best interest which again is meeting their fiduciary obligation. If they don't have that information, they can't do that. And therein lies the problem of
Right.
why one can argue that if you if the law currently is not getting this information in the hands of the plan sponsor, we've got to figure out other ways to compel the service providers to get that information into the hands of the plan sponsors so they could do their job. And my argument is one way to compel is by making this plan service providers a fiduciary for pricing and claims data purposes.
Right. Yeah, they can't have them both. Absolutely. I agree with you, Chris. That makes sense. If a CFO, HR leader, CEO is listening in plain language, why does it matter whether pricing data is considered a plan asset? How is that going to help them? Or just the information on what the carrier is willing to share?
If the plan sponsor and CHRO or
Mhm.
other HR managers,
Right.
they need that information to help the plan sponsors. And in some cases, they might themselves be a fiduciary under ERISA as fiduciaries or as the plan sponsor working for the plan sponsor an ERISA fiduciary. They need that information to, again, keep health plans costs low
Right.
by doing certain things, renegotiating rates, finding a new network provider, developing your own network if you want to, direct contracting if you're big enough to do something like that.
Right.
But then other things like developing cost containment programs or incorporating them into their benefit offerings that comes with getting access to the claims data. And the overall point is if the HR managers, the CHRO, as well as others in the industry are not getting that data from the plan service provider, and I keep saying the insurance carrier-owned TPA, which is typically the owner of the provider network. If you're not getting that information from them,
Sure.
how can you compel them to give it to you?
Hmm. Yep.
And my argument is one way, it's not the only way, but one
Hmm.
way is to clarify that that information is a plan asset, which thus would make them a fiduciary. And if they don't share that data, they expose themselves to fiduciary liability, which arguably would change that behavior and effectively, you keep using the word, compel the carrier to share that data. And that information is something that, to your question, the CHRO, the HR manager,
Hmm.
others in the industry, the brokers, the consultants working on behalf of the plan sponsor, they need that information
Hmm.
because they're there in most, if not all cases, to help the plan sponsor keep plan costs low and keep their plan sustainable from a long-term perspective.
Absolutely. So, Chris, why do you think they're still resisting? What are they trying to hide something? What's the deal? It seems pretty straightforward. Show the price. Every time you go to a car dealer, there's an MSRP sticker. So, why do you think the insurance owned TPAs and networks? Why are they resisting?
On the pricing side, I don't want to be accusatory, but on the pricing side, we're seeing that particular insurance carrier on TPA with a network might negotiate different rates with different providers for
Hmm.
different plan sponsors. And
Okay.
the differing rates between those providers and those plan sponsors is generally something that those insurance carrier on TPAs don't want public. They
Right.
don't want those plan sponsors to know that, like, if I'm plan sponsor A and you're plan sponsor B, and
Hmm.
I'm finding that I'm paying 10% across the board higher rates than you, plan sponsor B, I'm going to say I'm getting ripped off. So I'm going to either go back to that insurance carrier and TPA and renegotiate and say, hey, what gives?
Sure. Yeah.
Or I'm going to go down the street and I'm going to find a different network
Mhm.
provider that is arguably giving me the same rate that you're getting
Mhm.
or even a better rate.
Right.
So I think that's part of the resistance for
Yeah.
accurately and completely disclosing pricing.
Mhm.
Another aspect of it too is, you have outliers. Some hospitals are way up here and others are service provider or medical providers, that is,
Mhm.
have lower rates. And some don't want to have that high rate and say, well, okay, I'm going to get pressure to come down. And though some that are on the lower side for a provider, they actually want that information because they want to see, hey, am I
Mhm.
charging too little relative to others? Now, this is on the provider side, mind you, not
Right.
necessarily the
Sure. Yeah.
payer side. But that, I think, is another reason why we're seeing some resistance in fully disclosing what that pricing information is. On the
Mhm.
data side, the claims data side, we know that there are mistaken payments. We know that there are overpayments of
Right.
claims. And if you have that data, you can effectively hire a data analytic firm or other type of information program integrity type firm that can root out and determine and find out, hey, did you pay too much for this claim over here?
Mhm.
Was that purposeful? Was that a mistake? Was it negligence? Was it willful? I think in some cases, the network provider owner that is actually adjudicating these claims don't want the plan sponsor to know
Right.
whether they made a mistaken claim or an overpaid claim or whether they purposefully did. There is some litigation that we recently saw in the Sixth Circuit where the Sixth Circuit found that a shared savings program by a particular insurance carrier, I won't name their name, but I
Mhm.
think everyone knows the case, where that insurance carrier and TPA was purposefully overpaying out of network providers, then clawing back that money. And under a shared savings program, they took a percentage of the money that they call clawed back.
Mhm.
That arguably is a violation of the law in many respects, but
Yeah.
that's an example of information that I would argue that those insurance carrier TPAs do not want the plan sponsor uncovered.
Right. No, I get that. On top of it, Chris, I mean, that data is important because how does an employer or a plan sponsor see things like, how to manage chronic conditions? Is the best thing being done to do that? Does it make sense? I mean, if I had a car that went back for transmission repairs 8 different times and I just got a number, this was paid, they won't tell me what was paid for which service. I can't manage that. So it's very close, when they're trying to do that.
Yeah, no, 100%. And that just goes back to trying to get a complete and accurate set of data.
Right.
So you can then not only determine the overpayment side of things,
Mhm.
but you can understand utilization trends. Do I need to incorporate a cost containment program? Do I need to offer different value-based design plans
Right.
within my benefit offering? Do I vary cost sharing to direct or encourage participants to go to high value services, low cost, high value services
Right.
relative
Mhm.
to high cost, low value services? And you can typically see that in the
Mhm.
data,
Right.
provided you have a complete and accurate set of data.
Exactly. Anything else that you think that employers, plan sponsors, TPA should know?
To your last question, it really comes down to fiduciary responsibility is a big deal. Not to say that's new. That's not a new
Right.
concept. Like
Sure.
we've always known that. But fiduciary issues and fiduciary liability is front and center these days because we are
Right.
seeing employee participant lawsuits
Mhm.
alleging fiduciary breach
Yes.
for decisions made by a plan sponsor or decisions not made by a plan sponsor.
Mm.
So plan sponsors need to get a better understanding and fully embrace what they are obligated to do under ERISA. In
Mhm.
addition, the service providers, like brokers and consultants, you actually need to know, maybe even more so than the plan sponsor, of what the plan sponsor's fiduciary obligations are. Because the
Right.
plan sponsor's looking to you as that trusted advisor. And
Sure.
so you need to guide them. You're not a fiduciary, mind you, but
Mhm.
you need to, in a way, act like one in
Right.
counseling
Mhm.
your plan sponsor clients to provide quality services to them.
Mhm.
And it really comes down to understanding your fiduciary duties. And the last thing I'll say, when it comes to pricing and data,
Mhm.
again, I'm of the opinion, some disagree with this, but I'm of the opinion that right now plan sponsors have a duty to
Mhm.
access that information and data, analyze that information and data,
Mhm.
evaluate it. And if they don't, I believe that they breach their fiduciary duty. Now, again,
Yeah.
the problem is they can't get that information. That leads to everything that we discussed previously. But that's an important thing that I think everyone should know, realize, and even going forward, maybe the government clarifies.
Mhm.
Hey, plan sponsors, you do have a fiduciary duty to go get that pricing information, analyze
Right.
it,
Mhm.
evaluate it. Same thing with the data.
Yeah, absolutely. I had Dr. David Schenker from Stanford on a couple of weeks or last episode, I think. He talked about the billing and administrative waste, and he estimates it at $1.7 trillion. That's huge. That's humongous. So getting that addressed too is a huge thing. So and that all it's all part of the same thing. It's overcomplicating the formula. So would love to have you back. I'm glad that you can do it. This has been a really important and helpful conversation. You've helped connect the dots between transparency rules, compensation disclosures, and really the core idea of pricing information and claims data that not are just nice to have, but essential to have for an employer's ability to meet their fiduciary duty. Before we sign off, Chris, if listeners want to reach you, find your work, learn more, how do they do that?
My email address is just Chris, CHRIS, at cclawandpolicy.com. So all spelled out.
Mhm.
Feel free to reach out via email anytime. And happy to have any conversations with others, with yourself once again, either coming back or you and I just having a email exchange and or a phone
Right, right.
conversation. So it's always enjoyable to chat with you.
Excellent. Great. And you as well, Chris. So, to our listeners, if today's conversation made you think a little bit differently about your vendors, your contracts, or your access to the data, share this episode with your CFO, your HR team, or anyone who sits in that fiduciary seat. If you'd like to learn how we help employers cut waste and regain control of their healthcare spend, visit fixmybenefitsnow.com or email me directly, ralph@thebenefitwhisperer.com. I'm Ralph Weber, and thanks for joining another episode of The Benefit Whisperer. We'll see you next time, and thanks again for being here, Chris.
Thanks for having me.